All across New York City, we've brought a new approach to public safety by investing in our young people. We know that if we do not educate, we will incarcerate. The choice is ours to make. That is why we connected thousands of at-risk youth with counseling and mentorship and helped set them on the path to college and career. This year, we began a $163 million expansion of 5 of our most successful programs that engage young people who need extra help. Programs like Fair Futures and College Choice. The investment will help us reach 8,000 young New Yorkers and help build a safer, more equitable city for all. Our entire administration, from our police officers to our youth officers, from our firefighters to our healthcare workers, will never stop fighting to keep New Yorkers safe. Building a better city also means addressing the housing crisis that affects our entire nation and has led to far too many people living on our streets. I've seen both sides of this issue, from living on the verge of homelessness as a child to patrolling our subways as a transit officer. When we came into office, we said the days of letting people languish on our streets and subways were over. It was not safe, it was not humane, and it was not going to continue under our watch. Thanks to the dedication and drive of Deputy Mayor Williams Isom and her entire team, we doubled the number of outreach staff working with unhoused New Yorkers and created new teams that brought together law enforcement and nurses. We helped more than 8,000 New Yorkers. 8,000 New Yorkers. Think about that for a moment. 8,000 New Yorkers we helped move off our subway system into shelters and committed to helping those who could not care for themselves. These efforts were not always popular, but they were the right thing to do. 3 years later, they're working. Just ask Antonio Durham. Antonio first entered our shelter system when he was just 14 years old. Unfortunately, it was not a good fit for him, and he slept into bad environments to sleep, and he slipped into chronic homelessness and drug use, sleeping in subway stations in the Bronx for several years. After connecting with our outreach team in December of 2022, Antonio agreed to try a safe haven bed, one that offered him his own room, personalized support, and more flexibility than a traditional shelter. And you know what? It worked. 6 months later, Antonio moved into a supportive housing apartment in the Bronx. We would not walk away from Antonio, New Yorkers. Just think about that for a moment. 14-year-old moving into a shelter system, feeling as though he has to go to the streets and live on our subway. If we didn't catch him, what would have happened to him? This is why we want to close Rikers, yes, but we have to close the damn pipeline that feeds Rikers. That's what this is about. And we're not going to give up on keeping our subway safe. Instead, we're going to double down. This year, we'll begin an ambitious $650 million investment. That's right, $650 million to tackle street homelessness in New York City and answer 3 crucial questions. How can we help people on our subways? How can we help people with serious mental illness? And how can we keep families out of shelters? When it comes to our subways, we know what works: safe haven beds. Safe haven beds, like the kind that supported Antonio, are one of the most effective tools we have for helping people on our subways and streets. So we're going to add 900 new safe haven beds. and get more New Yorkers the help they deserve. Second, we must do more to help people struggling with serious mental illness. We can't just walk past them and act like they can take care of themselves when they can't. We know that too many New Yorkers cycle between the hospital and homelessness. So we're going to build a new housing facility just for unsheltered New Yorkers with serious mental illness to give them the help and care and specialized support that they need. And finally, can we keep families out of shelter in the first place? Having a child should be the greatest day of your life. It was for me. You should not have to worry about where you and your baby will sleep after leaving the hospital. You should not have to worry about whether your child will grow up on the verge of homelessness. But right now, we have too many expectant parents entering our shelter system. So today, we're making a new commitment to our families. No child should ever be born in our shelter system. This year, we'll launch a new program to connect soon-to-be parents applying for shelter with services that help people find permanent housing before their child is born. We must stop the cycle of poverty and housing instability before it ever begins, and ensure mothers and babies do not go to a shelter after leaving the hospital. Subways, serious mental illness, shelters. That is how we make a renewed commitment to tackling street homelessness.